Hi guys, how are you doing? Koaje, how have you been? Um, I'm okay. So today I have an interesting topic. I want to talk to new mamas. Today I want to talk to the new moms. Uh, we're going to learn a few things after giving birth. New moms, after giving birth, you have so many questions. You are anxious. Okay, you are happy. At the same time, you are anxious. You have a lot of questions. You don't know how you are going to take care of your little angel. So today I want to take you through a few tips on how you are going to take care of your new baby when you are discharged from the hospital. So after giving birth, you stay in the hospital for 2 to 3 days depending on the mode of delivery. So if you went for normal delivery, you might be discharged the following day if you don't have any complications. And if you gave birth through CS, the most you can stay in the hospital is 3 days. If your baby is okay and you are okay, you will be discharged. So you are being discharged from the hospital. You are going home alone, where there are no nurses, there's no doctor. If you are a new mom, I know you have so many questions. You are worried, how are you going to take care of this baby, how are you going to birth your baby, how are you going to change this baby, and also for old moms or the moms who are giving birth for the second time or third time or fourth time. It's not always easy. I know every time you give birth you have questions. So today I want us to learn on taking care of a neonate or a newborn baby at home. Okay, so and at the end of the topic, if you have a question, remember to ask me down there in the comment section. I will try in my level best to answer your questions. Okay, so you are now going home. What are you supposed to do to this new baby, or how are you going to take care of the baby? Number 1 point: breastfeeding. Immediately you give birth, breastfeeding is initiated between 1 to 2 hours after birth. So so once the baby has started breastfeeding, the baby feeds on demand. Okay, sawa. The baby feeds on demand. Every time your baby wants to breastfeed, just breastfeed the baby on demand. And then it should be exclusive breastfeeding for 6 months. By this I mean, you are not going to give your baby anything other than breast milk. No water, no tea, no uji, nothing. Just give the baby only breast milk, exclusively breastfeeding for 6 months. After 6 months is now when you are allowed to introduce your baby to other feeds. But for the first 6 months, the baby should breastfeed exclusively. And then the baby should feed after every 3 hours. Okay, so I told you, breastfeed the baby on demand. So there's a baby who can breastfeed, maybe nyonye na asishibe. They can feed again in between 3 hours. If your baby doesn't if he feeds or she feeds and then she's not full, she can again breastfeed between these 3 hours. But If the baby is full, they will need to breastfeed again after 3 hours. But if they want to breastfeed in between these 3 hours, just breastfeed your baby. And then breast milk is the best milk to give your baby, and it has several importances. Okay, so number one, breast milk has nutrition. Okay, it has all the essential nutrients that your baby requires. So there's no need of you you start asking yourself questions like do you need to give your baby fruits? Do you need to give your baby water? No, you don't need to give your baby anything. Breast milk has all the essential nutrients that the baby requires, and then it's easy to digest. You see, this small baby, the neonate, her digestion or its digestion, the baby is new. The digestion has not matured, or he can't digest complex meals. So breast milk is easy to digest for this baby, and then it has no allergies. You know that is another importance. There are some babies, when you give them eggs, you give them milk, they have allergies. One importance of breastfeeding is breast milk has no allergies. So for the first 6 months, can you just enjoy breastfeeding your baby, knowing that you will have no issues or complaints or your baby getting allergies, because breast milk is it's just the best. The baby can't develop any allergies, and then it is ready. Breast milk is readily available. If you want to travel with your baby, akisikia njaa, chakula yake iko tu na wewe, just breastfeed the baby. It's readily available. Every time your baby wants to breastfeed and you're around, the baby just feeds. No hassles like sijui mtoto ameamka nafaa nimtengeneze maziwa, nimtengeneze chakula. No, it's readily available. It's at the right temperature. No, hakuna ati unafaa kuenda kupasha. No, it is at the right temperature. Mtoto amesikia njaa, go ahead and breastfeed. And then it contains antibodies. Antibodies are the ones that fight infections in our bodies, and they are available in breast milk. So those are some of the importance of breast milk. You see, like, it's all round. It's readily available. It has all the nutrients. It has antibodies. It is at the right temperature. It's not expensive. It's easy for digestion. Yani, this is all your baby needs. Don't struggle. Just what you need to do is drink a lot of fluids. Kunywa maji mingi, kunywa uji, kunywa chai, kunywa fluids, kunywa kwa wingi, so that you can have flow of milk for your baby. And then breastfeeding is also important to you as a mother. How? It helps you lose your weight. Okay? When you breastfeed your baby exclusively, it helps you to shed away that weight that you added during pregnancy, and then it helps the uterus to contract and return to its original size. Potty. You see, is it really the potty? You see, when you give birth, you see the uterus was enlarged to accommodate the weight of your baby or the size of your baby. So once you give birth, your uterus haitarudi like immediately to its normal size. It's gradual. So breastfeeding helps. How? There's oxytocin that is produced when you breastfeed, so it helps your uterus to contract. Utasikia tu ni kama it helps it to contract and reduce to its normal size, and then breastfeeding reduces the risk of getting ovarian and breast cancer. So breastfeeding is important both to you and also to your baby. Well, some mothers will ask, how will I know that my baby ameshiba? Ntajuaje mtoto wangu ameshiba nikimnyonyesha? Indicators that will help you know that your baby is breastfeeding fully is it depends on how the baby pees, how he poops, and also weight. Okay, kama ulizaa mtoto na 2.5 kgs, this baby should add weight. Okay, so if you see your baby is growing or adding some weight, meaning anakula, ananyonya, anashiba, and then peeing, ideally a baby should you should change a baby's diaper 4 to 6 times in a day. That is a unit in the first week, 4 to 6 times in a day. So in the second week, you know, the more the baby grows, the more the intake increases. So this week kama alikuwa anakunywa 100 mils of milk anashiba, next week ata improve, ataenda 110, 120, 130 mils of breast milk, and the more anaendelea kuongeza, the more pia changing diapers itakuwa more. So in the first week, at least you should change your baby's diaper 4 to 6 times in a day. Okay, huyo sasa ndiye mtoto amenyonya akashiba. The second week it will continue increasing, and then poop, the baby should pass stool between 1 to 10 times in a day. Sawa sawa? Yes, but at least depending na the amount of milk mtoto anakunywa, so they will poop between 1 to 10 times in a day. Okay, yes, so that is it about breastfeeding. And then you should be able to take care of your baby's umbilical cord. Unajua umbilical cord, the how is it called? The umbilical cord, I hope you understand, the navel. So when you give birth, the umbilical cord is clamped and then it's cut. Sawa sawa? So when it's cut, you will see it's clamped. Mahali utaona imewekewa kitu kama kapeg. It's just an umbilical cord clamp. So the baby's umbilical cord, that stump, should be able to dry between 1 to 4 weeks. 1 to 4 weeks. What are you supposed to do? You will be given instructions from the hospital. Keep it dry and clean. Sawa? Keep the umbilical cord dry and clean. And then don't use soap and also spirit or alcohol to wash the umbilical cord. Sawa sawa? Do not use soap, do not use spirit, do not use alcohol like these sanitizers to wash your baby's stump. Just wipe it with clean water. Not clean water. Get a cotton wool, soak it in water na ufinye, and then just clean around the navel. Hapo tu kwa cord kwenye imeshikilia na mtoto, wipe there, wipe, and then wipe like 3 times. Una wipe, unatupa, another one, wipe, tupa, wipe, tupa 3 times, and then dry the place. Make sure it's clean and also dry. And then when you are changing your baby's nappy, make sure, okay, make sure the place haishiki uchafu, like choo, like stool, the baby's stool. So every time your baby poos, make sure you change the baby as fast as possible, so that the poop in any means cannot get to the umbilical cord, because it will contaminate and the baby will get an infection. And then another thing is ensure it's clean, ensure it's dry, ensure no poop gets to that place. And then ukifunga mtoto diaper, do not enclose the stump. Usifungie hiyo stump na diaper. Ukifunga mtoto, make sure diaper iko below the stump. So funga diaper ya mtoto chini ya kitovu, and then mvalishe loose clothing yenye haita finya. So ukishaweka diaper chini yake, now you can dress the baby with loose clothing, so that the stump can get like aeration or ventilation, so that it can heal faster. Sawa. It should fall off between 1 to 4 weeks. And then if you notice that your stump imeanza kutoa a foul smell, inanuka vibaya, and then if you notice it's discharging, maybe pus, and then if it does not it does not kama haitaanguka past 4 weeks, now you need to see your doctor. Sawa. When to see a doctor? When it starts discharging pus or blood, when it's foul smelling, kitoa harufu mbaya, or when it's 4 weeks and it has not fallen off, go and see the pediatrician. And then another point, you should always check, you should always do a physical exam for your baby. Do you know what I mean? A physical exam is just a general exam, examining your baby. Just every time maybe ukiosha mtoto, just take your time. Angalia huyu mtoto kuanzia kichwa hadi kwa vidole chini. Check for any abnormality. Sawa. Check for, angalia nywele ya mtoto, angalia the eyes, check if the baby's eyes are okay. Check for color. There's a disease called jaundice. Jaundice is when your baby's skin or eyes start turning yellowish. Okay, that's why it's important when you examine your baby on a daily basis. So check for the eyes, mwangalie masikio, mwangalie the body, and then check for, mwangalie umbilical cord, mwangalie the private parts, angalia kwaje. If you notice your baby's skin color is turning to yellow, make sure you see a doctor, because the baby is developing jaundice. Another thing, vitamin C. Make sure ukitoka, before you go home from the hospital, ensure your baby amedungwa a jab of vitamin C. And then eye care. Sawa. Ask your nurse if your baby was given a tetracycline eye ointment. Very important. And then keep the baby warm. Ukiwa home, make sure the baby's temperature is 37 degrees. That's 7.5 degrees. That is the ideal for the baby. Keep your baby warm. Funika mtoto, mvalishe kofia. Then don't overdo. Don't overcover your baby, because heat, atapata heat rash, and also heat is not comfortable. Okay? Just don't overcover, but make sure you cover your baby so that you maintain warmth. When you wash your baby, make sure you cover the baby. Immediately you get the baby out of water, cover that baby, okay? And then don't expose the baby for a long period of time without clothes. And then make sure the room, kwenye unamwoshea, first make the room warm. If you have a room heater, you can heat the room first for like 10 to 15 minutes before you expose your baby now. Before utoe mtoto nguo, warm the room if you have a room heater, or if you don't have, washa mtoto mchana wakati kuna jua ama kuna joto. Sawa sawa? And then another important point is make sure una expose mtoto kwa jua. Sawa sawa? Early in the morning, between 7 to 10 a.m., expose your baby to sunlight, because it helps in vitamin D absorption, it helps vitamin D, which is a key in bone formation. Sawa sawa? Yes. It helps prevent rickets. If you have seen, even this one is well known by like everybody. Ukisikia mtoto akona rickets, you just automatically watu wanajuanga hakuoteshwa jua. So the best thing is expose to mild sunlight, because vitamin D helps in calcium absorption, so that your baby's bones can be strong and the baby can't get rickets. Okay, another thing is change the baby's diaper once they are wet or dirty. I have told you that one. Ensure you change once the baby's diapers are wet. Unajua mtoto mwenye diaper iko wet anaweza lia, you might think the baby is sick, kumbe it's just the diaper iko wet ama ame poop. Change immediately so that poop can't get to the umbilical cord, because it can contaminate it. Or if the cord has fallen off, just for the baby's comfort, change the baby's diaper. Sawa sawa? About washing your baby, you can wash your baby like 3 days a week. 3 days a week is just okay. Use a simple sponge to wipe your baby. Use a sponge to wipe your baby, because if you immerse that baby in water, is it immersing? If you put that baby in water, like the stump might take long to heal. Sawa sawa? And also you might not dry it very, very well. And if you can't dry it well, for it to heal, it needs to be dry and clean. So it might be clean, you might wash it in water, but unaweza kosa make it dry as required. So it's advisable that you wipe your baby 3 days a week. Kama stump haijanguka, it's not advisable to put the baby in water. Just wipe the baby with a sponge, and then wipe the umbilical cord area, and then just keep your baby warm. Sawa? Avoid all scented products. Actually watoto hawahitaji hizo. Unanunua vitu ziko na very strong scent. Sorry, even they affect the baby. Sorry. The baby's products should be gentle and unscented. Even you as a mother, during this time, you are not allowed to use scented perfumes, scented mafutas, because it's not wise. It's not wise. You might even expose these babies to allergy at that tender age. Sawa sawa? About sleeping at night, make sure your baby sleeps in a warm crib, and then ensure you wrap your baby in a swaddle. Okay, do you know a swaddle? A swaddle? In a swaddle, do you know a swaddle? I'll show you an example. Do you know why? Because these neonates, you know the way neonates just play, wanashidanga mikono iko all over na miguu. So if you cover this baby with a loose blanket, let's say umemfunika up to here, and then when they wake up, they just start playing with their hands. They might end up bringing this blanket, pushing it mpaka upate amejifunika. Sawa amejifunika, and it's so risky. So avoid loose blankets, avoid covering the baby's head. Always the best position for your baby to sleep is supine. Let the baby sleep on his back. Sawa, let the baby sleep on his back. That means the baby should face up. Avoid toys in the baby's crib. Avoid pillows. Avoid loose blankets. And yes, always make sure you wake up as many times to check on your baby, because this baby can just this baby might wake up wakati umelala and start playing with the blanket around, and then anaweza end up suffocate. The baby might end up suffocating because of that blanket. Unajua, he will just pull it up imfunge also, and then he will start struggling to kuitoa, which he can't be able to do, and then he might end up suffocating in that blanket. Sawa. Yes, that is it. And then another thing, remember to come back again to the hospital for vaccination. So what should you do? Save that date yenye umepatiwa ya to come again, so that your baby can get vaccinated. Okay? Yes. So that is it for today. Taking care of a neonate at home. If you feel like there is something I never talked about that you need me to help you know, just ask me down there in the comment section, and I will try in my level best to answer you. Thank you so much for watching. See you in the next session of learning.